Morning all. I welcome you all for the 11th session of ATAL-based online faculty development program on the topic Internet of Things, enhancing smart IoT applications using advanced processors. It's my immense pleasure to welcome the session speaker, Sir, Professor Dr. Muruganantham sir, who is registered in a Saintgits group of institutions. He is one of the subject expert and resource person of National Board of Accreditation and approved valuer, machinery and plant engineering, chartered engineer too. He is holding 5 Indian patent journal publications, which includes improvement of trivial and secure IoT device management and eliminating security issues in IoT using blockchain. He mentored more than 75 faculty development programs in outcome-based education. He is one of the recipients of APJ Abdul Kalam Technological University OBE FDP fundings. He participated in peace engineering in New Mexico, USA. He is an active member in American Society for Engineering Education. He has been an academic auditor of APJ Abdul Kalam Technological University in Kerala. His areas of research interest include renewable solar energy resources, autonomous vehicles, and engineering education. In addition to that, he has been emerging technologies of IoT and blockchain. He acquired International Certified Career Coach Level 1 certificate from Career Development Alliance. He served as a National Executive Council member for Indian Society for Technical Education. He is nominated by ACTE to serve as Margdarshak, mentor to engineering colleges to streamline the SOPs to acquire MBA. He was selected as Program Evaluator Candidate of Accreditation Board for Engineering and Technology. This is the 39th expert talk in his AACTE FDP during this pandemic period. I welcome you, sir.
Thank you, Professor, for your brief introduction. Can you give me the rights of sharing my slides?
Sure, sir. Sir, you can share your content now, sir.
Yes. Let me get. Yes. PT screen is visible to the participants and I am audible to you, right? In between, if you are getting disconnected, please interrupt me and continue. Good morning, all. Thank you for the institution P.S.R. Engineering College, Sivakasi, for giving me a chance. I think I am talking with you for the 8th time in this season, right? And you people are very much interested in this particular topic, which is an emerging topic. I think my screen is visible. Yes. Give me a moment. Right. This and I think more than 100 plus participants are gathered here with or without the interest of knowing something or doing something or executing something in the sector of Internet of Things. When we talk about the Internet of Things, it is a system of interrelated computing devices, of course, mechanical and digital machines, objects, animals, or people that are provided with unique identifiers and the ability to transfer data, right? To transfer data over a network without requiring human to human or human to computer interaction. In short, the Internet of Things refers to the rapidly growing network of connected objects that are able to collect and exchange data using embedded sensors, thermostats, cars, lights, refrigerators, and whatnot. More amount of appliances can all connected to the Internet of Things. Why the Internet of Things is called the Internet of Things? Because the definition itself, I mentioned the sensors and the actuators embedded in physical objects are linked through wired and wireless networks. When I say wired and wireless networks, again, in the previous session, speaker mentioned about the internet speed and the internet quality in our country, but in a generic way, it can be. I will explain briefly when the slide comes. So there are a number of similar concepts, but Internet of Things is by far the most popular term to describe this phenomenon. The term Internet of Things, invented, as you know, in 1999, initially to promote RFID technology. The popularity of the term IoT didn't accelerate until 2010 or 11 and reached mass market in early 2014. When we talk these kind of terminologies, it is always utilized for the purpose of human safety in a higher manner. Of course, we are utilizing with lot of examples. I can say the wearable devices, fitness trackers like Jawbone, Fitbit, Pebble, or we can say home automation, industrial asset monitoring, smart energy meters. Like that, we can describe n number of things. So this Internet of Things, again, if you want to define, say embedded in physical objects are linked through wired and wireless networks, often using the same internet protocol that connects the internet. See, this Internet of Things definition leads to an interesting question. If the Internet of Things is not necessarily part of the internet, as we know, right? Why then it is called Internet of Things? With this question, I thought of opening this morning second session, and I hope the participants will have a large amount of questions, and of course, we may discuss IoT towards healthcare industry. I chosen this topic often because the healthcare industry, which is mandatory or which is badly required for the humans, not only humans, animals in the universe. We are suffering a lot. We are suffering different or unexpected things where the Internet of Things is making us to overcome such kind of unexpected issues. This particular term have been proposed but don't mean exactly all the same, or when I say so, I can say machine-to-machine communication or web of things or industry 4.0 or industrial internet of things or even smart systems, pervasive computing, intelligent systems, right? We can brief this particular term in n number of terminologies. Again, it depend upon the situation, depend upon the industry where we are going to deploy or where we are going to utilize this Internet of Things. When we say Internet of Things, this is purely a technology. It is not a perfect engineering. Of that, most of the engineering colleges are getting attraction towards getting admission for computer science. Unfortunately, the core engineering branches like mechanical, civil, electrical are not getting attraction because those people are not coming up with the implementation of these kind of latest technologies in their day-to-day activity. In fact, the Industry 4.0 is intended to implement or plant these kind of technologies to make the mechanism to make the electronical things or make the electrical items, even make the transport things into a smart way. Because of that, it is mandatory for each and every activity of our day-to-day life. It is preferable, it is recommendable, it is advisable to implement or inside these kind of latest technologies. Without the Internet of Technology, definitely we cannot go forward in the coming days. So, for the betterment, for better knowledge, I thought of sharing something related with Internet of Things, which is involved in healthcare industry along with artificial intelligence. When we say Internet of Things, the latest, most hyped concept in the IT world, I can say like that. An open and comprehensive network of intelligent objects that have the capacity to auto-organize, share information, data and resources, reacting and acting in face of situations and changes in any type of environment. The Internet of Things may be defined as a network of networks where the end devices are not user-handled devices, but can be computing devices, mechanical and digital machines. They can even be objects that can be provided with unique identifiers that transmit and receive data without active human intervention. That's what I told at the opening remarks of this particular session. Again, I mentioned the same thing. The Internet of Things can be mentioned in different terminologies. Simple word, we can say like this: almost anything, including living things connected to the internet, regardless of location or other physical restrictions, will be called as Internet of Things, right? When we deal with Internet of Things, we cannot omit certain other categories. One category is data analytics, or we can say big data. The use of IoT can be associated with the generation and manipulation of vast amounts of data that may relate to human behavior and interaction, that is called big data. Always we are using such kind of data analytics. Maybe we are unaware in some occasions. Unknowingly, lot of things transmit from one point to multiple point as well as vice versa. But when we go for doing such kind of manipulation in big data, it is resulting potentially high impact, for instance, on privacy, security, and consumer welfare. If you are talking about IoT, it is a process driven. There are different classification, we can say process driven, product driven. When we say IoT, it is a process driven, right? When I said IoT, we are supposed to think of data, which means certain amount of records or data has to be observed or collected, and it is transmitting to some other point for further usage. So obviously a monitor is required. For best example, I can say like this: a heart patient who is implanted a device which is used for observing the heart beating, right? The person is not responsible for transferring data, but whatever the thing happening in his body, in context of heart, the device will monitor the number of beatings. So it is observing the number of beats of the particular person's heart, and it is recording. Soon after record, we will analyze, so that we are supposed to think of this machine learning tool or deep learning tool, which is another term called as artificial intelligence, where we set a pre-data. That data will be compared with the data, so the analysis is going to take place. Doing such kind of analysis by using the algorithm which is set as in the device, is exceeding the limit or going below the limit, then it will start giving an alert in terms of some amount of signals. That's what trigger alert. Probably if it is getting by the close relatives or the hospitals or the doctors or the individual person himself or herself, they will take action for the rectification. So this is what the process is happening if you are going to implant any type of such kind of sensors. So at the beginning I told it is not the only duty of computer science people or computer technologists. It is supposed to involve with some amount of electronic engineers, some certain amount of data analytic people, some certain amount of even mechanical people too. So it is a technology can be utilized by multiple people, maybe maximum number of the people in the society. So because of that reason, this particular IoT is emerging like that. If you are looking the predictions or forecast made by several agencies, right? If you are looking the Gartner, it is mentioned as 26 billion. If you are looking the Cisco, it is 50 billion. Morgan Stanley, 75 billion. And of course, Intel is having more than 200 billion. If you are looking the human brain, it is having only 86 billion neurons. Just imagine how much it is going to make traffic in the internet line. And how much it is going to get clash and how much we are effectively making operation, right? So just for a refreshment, this is a simple example, right? This is having energetic students as well as faculty made this. In this particular situation, in this particular situation, to sanitize our hand continuously for 20 seconds. And I am sure none of us are watching the clock and going for sanitizing, right? Most of us are thinking by having some mindset. But this particular equipment, when we press the button, it will start giving a music for continuously 20 minutes. So that the persons will continue sanitizing their hands for the required time period. Whatever we said, there are some challenges, there are some disadvantages, right? My doubts, my challenges, my feelings, when we go for deploying this IoT, are we going to rely on the technology in a higher way? Because of that, the people or the society is going to lose the thinking capacity. Because everything is on the single touch, right? In that scenario, are we going to lose such kind of any thinking capacity among the people's? That is one of the questions. Second one, when we go for deploying this Internet of Things, especially in the core branches like mechanical, civil, electrical, that too in healthcare, are we going to lose the job? When we allow the equipments, when we allow the tools to observe data, specifically like heart beating and other problems, whether our privacy, whether our individuality will build among others. In generic, right? As a societal person, these are all few things challenged towards the implementation of Internet of Things, right? As you know well, the person who invented the term, Kevin Aston, in the year of 1999, already I told, he is not intended to make it, he is intended to attract his superiors. Of course, it is mandatory even today. We are supposed to attract our superiors by our energetic activities. Similarly, this Kevin Aston also did when he was working in Auto ID labs for the purpose of RFID technology, right? Similar to the QR code scanners, barcode scanner, digital water mapping, etc. things are all working under this IoT. Of course, It is not worked out well for more than a decade, but after 1 decade, it emerged nothing like that. When we talk about this IoT, where and all we can apply, which are all the areas in the topmost. The vessel P of IoT has become very popular in the recent, say, 5 to 7 advantages to have a device based on IoT. As I said earlier, a lot of agencies are forecasting, lot of agencies are predicting. Similarly, the largest agency, one of the largest agency, which is called the McKinsey Global Institute report, is mentioning like this: 6.2 trillion in revenue by 2025 in this particular IoT area alone. Why? What are the areas they are mentioning? If you are asking so, right, I can say the home automation. The home automation, right? At least a few participants' house overhead tank can have a sensor. Whenever the water level goes down, the trigger will automatically start to ignite the motor pump. This is a power switch named as Wemo. As on the date, it costs 2000 plus in the market, which can be controlled by our mobile app. So that utilize this IoT for the home automation. When it goes into the next stage, enterprises level, of course, few of our houses, few of the highest hotels, restaurants are having this kind of system. According to the number of occupants, the system will automatically adjust the temperature. I hope many of us witnessed in the past. Next, we can say about this utilities and energy management. In the recent past, for the past 3+ years, all the states in our country are still executing the production of energy from different sources. Often we are hearing about the smart grid in the news media. I am assuming that the participants are from computer science batch or computer science background. I am saying this. In that scenario, within the next 1 decade, definitely the power production or the energy production in our country will go beyond the required level. In that situation, how we are going to control the distribution, how we are going to control the transmission without much loss. Definitely there will be loss. How we are going to reduce it? By the implementation of IoT. In the digital grid or smart grid system, it is already in the process. Of course, the transportation area. Maybe because of the corona situation, all the toll gates are already getting conversion from conventional model to this IoT model, FASTag. I hope you people are having a very good experience of this, right? Not only that, including the goods, we can go for such kind of operations, right? Next, the large scale deployment. Whatever I said for the past 5 titles are all in a low scale or in a medium scale. What about the large scale? The video which I played on the background, right? That is taken from a man-made city. It is in South Korea. The town or the city is called Songdo, Songdo. The first of its kind fully wired smart city is Songdo in South Korea, which means it 1,500 acres. It is having more than 100 buildings. Every building is having more than 20-30 floors and almost millions of square feet constructed. In this particular city, as of now, more than 60,000 people are living. It is about to complete in this year due to several reasons, not yet completed, but it is already commenced. All the activities happening in this campus, in this particular city, is monitored through IoT. That too, wired connection. In India also, we are having such kind of smart cities announced by Government of India, but not yet completed anything fully, except Ahmedabad city, there is a city, right? So like this, we can go for applying IoT in different places. When I said this song though, right? When I say this song though, all the 100 plus buildings are green certified buildings. Just imagine how much the CO2 emission will be happened in this case. We will discuss such kind of things in the afternoon session. And the last application which I want to say is the medical and healthcare. Medical and healthcare, which is my favorite, because the reason it can be used to any type of people and it can save the life of people in a quick and less effort. So the IoT is having lot of positives so that we no need of worrying about the negatives which I showed the earlier thing. Right. I think the top screen is hiding you something. I am not able to move it. Okay. It is not possible. Okay. Now I think it is correct. So when we go for discussing this topic, I thought of giving you this term. Often we are having the term healthcare and healthcare in single word and double word, right? Most of the cases we are not familiar with this, right? I think I took almost 30 minutes so far. There is a polling which I shared in your chat box, right? You just click that link and go for giving your poll, or go to mendy.com by using the code 5539885. You give your polling. Because I am not aware that participants' background. Without knowing that, it is difficult for me to deliver in an effective manner. I think I shared that particular link in your chat box. Click it and move to the particular screen and give your poll. By the time I can show the results too. Give me a second. I think my screen is not changing. I will check my answer. You can 10 seconds. You please complete the polling. Almost 20 participants made that poll. Among the 20, 11 belongs to computer science, 2 from information technology, and 2 from MCA. Okay, 1/4 of the people are non-engineering, non-computer science background. Among the polled participants. Okay, let us continue. I can do one thing. I can keep open of this poll till end of the day. You can do it later on also. So when we go for discuss about this healthcare system, we are supposed to go for think about this patient, provider, as well as payer, right? See, before Internet of Things, patients' interactions with the doctors were limited to visits and tele and of course text communications. There was no way doctors hospitals could monitor patients' health continuously and make recommendations accordingly. These IoT enabled devices have made remote monitoring in the healthcare sector possible, unleashing the potential to keep patients safe and healthy and empowering physicians to deliver superlative care. That's what I can say. It has also increased patients' engagement and satisfaction as interactions with the doctors have become easier and more efficient. Furthermore, remote monitoring of patients' health helps in reducing the length of hospital stay and prevents readmissions, right? So in this scenario, we are supposed to think of patients, we are supposed to think of physicians, hospitals, and of course, insurance. In the case of IoT for patients, devices in the form of wearable fitness bands and other wirelessly connected like blood pressure and heart rate monitoring cuffs, glucometer, we can say a number of devices. Give patients access to personalized attention. These devices can be turned or tuned to remind calorie count, exercise check, appointments, blood pressure variations, and much more. So this IoT has changed people's lives, especially elderly patients, by enabling constant tracking of health conditions. This has a major impact on people living alone and their families. On any disturbance or changes in the routine activities of a person, alert mechanism sends signals to family members and connected people. Similarly, in the case of IoT for physicians, right? Similarly, IoT for hospitals. But what about the insurance companies? Do we have such kind of mechanism in our country? Things. So there are numerous opportunities for health insurance with IoT connected intelligent devices. Insurance companies can leverage data captured to health monitoring devices for their underwriting and claiming operations. I can say some example in this case. Assuming that a person who is regularly travel abroad, term travel insurance, which means travel medical insurance. As soon as the person go out from the country to other countries, and if he find any medical issue, he will be given insurance. We are having such kind of system in too. Just imagine this story. A person who made such kind of travel insurance, after making travel, he thought of discontinuing so that the investment over medical travel abroad insurance will go waste. Can we assume like this? I am the person who is traveling often to abroad. So I made a smart contract with the insurer. As soon as I left from the country, the insurance has to switch on. As soon as I come back, the insurance has to off. This is the smart contract. I given as a contact device. In addition to, as soon as I reach the airport, the system is triggering and giving me a message, are you traveling abroad? I am just giving yes, and I am leaving the country. When I give the respond yes, the travel abroad insurance is getting active. Yes. As the participants raised in the morning, we are supposed to have such kind of network and quality of internet connection. As soon as I return back, system is giving a trigger, I am receiving a message, are you reached homeland? As soon as I responded, the insurance is getting disabled. If you are having a system, how much works we can eliminate? How many works can be eradicated? Assume problem when I am in the outside country. As soon as I entered into the hospital, when the hospital authorities entered my data into their system, again, a particular hospital system will send a trigger to the insurance company and revert. No need of again calling some people or sending mail or meeting some people or even for going to verify the people. Here, the only question is ethical thing. Again, we will discuss those topics in the afternoon session. So, IoT is a powerful mechanism, powerful application. That too in healthcare, if you are implementing, that will make us in a bigger positive things. How it is going to redefine the healthcare? When we say redefining healthcare, right? The opportunities, the possibilities are huge. As I said, when we go for doing these kind of things, we are required a good quality of connection. Of course, not only computer technologists, we are required interdisciplinary activities too. Why? We want to get the data. The first step consists of deployment of interconnected devices that includes sensors, actuators, monitors, camera, whatnot. So these systems are collecting the data, right? Usually the data will be collected from these kind of equipments or devices or are made in analog form, which required to be aggregated and converted to the digital form for further data processing. Once the data is digitized and aggregated, right? Once the data is pre-processed and standardized, it will move to the storage, which we generally call as data center or cloud or servers. Of course, if you are going to use blockchain, it will be stored in different computers, say a million number of computers. Right. Once we do the storage, then we may go for thinking about how we are going to analyze these data. The final data is managed and analyzed at the required level. Advanced analysis applied to this collected data brings actionable business insights for effective decision making. It's simple to brief. when we go for deploying, again, we have to implement several other technologies like data analytics, machine learning, deep learning, certain amount of hardware things, and so this is the process. This is the way we can go for redefining healthcare by using the technology IoT. See, this IoT is redefining the healthcare by ensuring better care, improved treatment, outcomes and reduced cost for patients, and better processes and workflows, improved performance and patient experience for healthcare providers. That's what I can say. While looking this, IoT enables patients monitoring in real time, thus significantly cutting down unnecessary visits to doctors, hospital stays, as well as readmissions. In the case of improved treatment, it enables physicians to make evidence-based information decision and brings absolute transparency. When I say improved treatment, it is related with the artificial intelligence, machine learning, deep learning, etc. algorithms, because it is supposed to give some predictions. It is supposed to give some decisions, right? And the third one, the faster disease diagnosis, continuous patient monitoring. I told the example of the person, heart patient. I hope you can recollect my earlier statement, right? So the continuous patient monitoring and real-time data helps in diagnosing diseases at an early stage or even before the disease develops based on symptoms. Fourth one, proactive treatment. Continuous health monitoring opens the doors for providing proactive medical treatment. The fifth one is again possibility for the participants even for starting their new research or project. The drugs, management of drugs and medical equipment is a major challenge in the healthcare industry. Though connected devices, they are managed and utilized efficiently with reduced costs. And the last important one here, please note, I didn't mention error eradication, error reduction. Data generated through IoT devices only help in effective decision making, but also ensure smooth healthcare operations with reduced errors, waste, and system costs. This is the major reason which I thought of sharing with you, because as on the date in our country we are having numerous amount of hospitals, facilities, but how many of them are having this kind of facility? During this corona period, we people felt that this online is unavoidable, right? When we use this kind of things, we are supposed to safeguard the data. The cyber security is the practice of defending server systems, networks, and data from malicious attacks. It is also known as information technology security or electronic information security. The term applies to contexts from business to mobile computing and can be anything, as I posted here: network security, application security, information security, operational security, disaster recovery and business continuity, and of course, I made here also this end user education. So these securities, these issues, how we are going to tackle when we go for implementing IoT in a full-fledged manner like South Korea's Sangdo city. Because in India also we are mentioned that several number of smart cities are coming up. In this situation, what activities happened from our side as academic researchers or academic project personality towards this particular sector? So this is again $1,000,000 question for the participants. Of course, we people are having vast area to choose our own interested sector for carrying out our research, irrespective of beginner or intermediate or an expert. Right? Next one. Why I said this? My topic is IoT in AI, IoT and AI in healthcare industry. When we look that, I spelled out there are several hackings or several issues towards security. Of course, we started such kind of cyber crimes in different terminologies, in different sectors with the different people of the society for the past several years. Few of them are well known to the participants. Of course, few of them are new to many of us. Even this crypto mining, we started this Bitcoin transaction in India very recent past as a legally. But still, we are thinking, we are afraid about such kind of traps. If you are looking in terms of number, but year, that is 2019, the numbers may be less in the case of trade, administrative, management, agriculture, mining, transportation, construction, and real estate. On the other hand, when you look the education, when you look the healthcare industry, when you look the manufacturing, the number is huge. These are all some registered incidents happened in the year of 2019. When you look that, the healthcare is having a major number. Of course, education is there. Of course, the finance also there, information also there. As on 2019, only 32,002 cases registered and many cases are not registered. Among the registered, healthcare also in a. So how we are going to stop it? What is the way out? I often used to say this particular quote by Walt Disney because we researchers are much interested to make things for the betterment of society, of course, the betterment of our financial term. That is the truth, that is the fact. We people interested to visit Walt Disney World best amusement park at least once in our lifetime because it is that much beauty, that much attraction. Of course, the person who created Walt Disney made such a statement that the amusement park may be somewhat better way because these are all made by some other parties. The only creation, dream and design is made by him. But in real, it is created by his own engineers and laborers. Like that, whatever we do, whatever we, the people, the society, those who are utilizing, has to have a peaceful satisfaction. When you year by year, it is increasing only. It is not decreasing. The investment towards the cyber security also increasing. The number of attacks also increasing, the risks also increasing, the investment also increasing. Of course, if we become as a cyber security expert, the revenue also goes high. The predictions, the forecastings are all getting breached. This particular slide is not appropriate for this time because it is predicted 29 billion during the year 2022, but it is already breached more than 50 billion devices connected with IoT. Maybe because of the situation in the world. Right? I am not going to brief this predictions in 2020, which is already over. Of course, future predictions, that is 2025. By 2025, it is estimated that there will be more than 21 billion IoT devices. Again, that is breached, already crossed 50 billion. Right? And the second one, the cyber criminals will continue to use IoT devices to facilitate DDoS attacks. Right? This is a major issue. Again, major sector, if you are taking the things positively, then it is a good one for us. We can go for giving real. Many cities are coming up as a smart one. Consumers won't be only ones using IoT devices. Cities and companies will increasingly adopt smart technologies for the purpose of saving time as well as finance. That means cities will be able to automate, remotely manage, and collect data through things like visitor kiosks, surveillance system, bike rental station, taxis. We can say a number. Then the artificial intelligence. When we say artificial intelligence, thermostat, lighting system, which I start at the beginning, I shown to you. And the fifth one, as a computer technologist, most of the people are from the computer area. Mostly the data is getting leaked to routers. Most consumer IoT devices reside in the home and cannot have security software installed on them. They can be vulnerable to attacks, right? Why? A lot of manufacturers work to get their IoT products to market quickly, so security may be an afterthought. So we may think of routers also to strengthen. Of course, India is not received these 5G networks, but it will continue to fuel IoT growth. Of course, we are talking about electric vehicle, autonomous vehicles. Maybe because of the arrival of 5G, will shift the auto industry into a highest gear. The development of driverless cars as well as the connected devices already on the road will benefit from data moving faster. Right? And the next one, the privacy and security concerns, maybe because of this 5G's arrival, let us wait and see in our country, but in the foreign countries, it is already proven. I told about DDoS attacks. When the 5G comes, definitely it will come in a different and danger form. We is not having much legislations or regulatory authority or rules, policies, law. Right? It is going to happen in the coming days. So these are all some future of IoT predictions made by the agency Accenture. Right. Next. We may ask, sir, how much the healthcare will get things. When we go for implementing this IoT in healthcare, we are going to use blockchain technology Or are we going to use the conventional model? When I say conventional model, it is so. Data centers or cloud. Which one we are going to use? What way we are going to implement this technology in healthcare? As in lots of other industries, the days of internal IT staffs at hospitals and other healthcare institutions are vanished as operations migrate to cloud-based software and service. Which means still we people are having a query about the implementation of blockchain along with IoT. So that most of the concerns, institutions, companies are thinking of still the server and cloud based. This is one segment. Of course, the telemedicine. When we talk about the improved telemedicine, the telehealth has been shown to overcome barriers to health services caused by distance between patient and provider, access to reliable transportation, fragmentation of care due to gaps in between appointments, and lack of available providers. It's a generic one. But if you are implementing this IoT with artificial intelligence, specifically some machine learning algorithms, the doctor can easily predict the disease of the particular or group of patients. Meeting with the doctor by the patients may be in a distant place. The electronic health records, EHR, electronic medical can be either in blockchain block or cloud or data center or server. If you are keeping the things record, blockchain block, then the security level may be in a higher way. So the doctor take decisions without having any hesitations. So the telemedicine is an emerging. If you are interested to do a variety of research, that project, we may think of kickstart our work in this particular field. So this blockchain technology, I told if you want to showcase that higher amount of security for the data, then we may go for implementing blockchain along with IoT. While it is having the potential to transform care, placing the patient at the center of health care ecosystem and increasing the security. Privacy, of course, the health data. Government of India already kick-start the pilot, not in healthcare industry, but in financial place, PFMS. We may think of it. Artificial intelligence about EHR, EMR. When we go for doing something with the help of ML, DL, definitely it will enhance the accuracy and creating faster and accurate alerts for the healthcare provider plus the patients. And importantly, the augmented reality, AR, VR. In the health industry, the heart patients are getting less mind sights when they go for a surgery. If you are demonstrating through AR before the real-time surgery, will make the patient to have a peaceful mind, which will lead to the success of such kind of surgeries. I think this is in very, very less number in our country, and we may think of it. Right? Because of the colleges are intended to put MOU with so much of medical colleges nowadays. For your information, the prediction will be like this. Within next 1 decade, there will be no separate engineering college as well as medical college. It will be a same campus. Why? For example, eye doctor is making an eye surgery by using a equipment or machine where he is supporting to build particular eye surgery machine. Nowadays, doctors are not doing by using their hand until plus depth problematic disease. Who is making such kind of equipments? All the engineers, which means we should thoroughly know how the things are happening, how the operations are happening, and what will be the side effects, and what will be the positives, negatives. Then only the machine will perform properly. Of course, we are making machines and they are utilizing. They are the users. So definitely we know the logic better than them. So why there is a need of separate MBBS or BE degree? We can go for combining. So that's what the prediction. Let us wait and see. So the trends are like this: the cloud-based healthcare support, improved telemedicine, of course, by using the blockchain technology, implementing artificial intelligence and AI. If you are looking the healthcare industry in the medical management, technically I am saying the term as medical management, we are having again several sectors. As a single person, we may not go for or inventing a package for sector. We need a team. That too, we are supposed to look and choose categories. In the screen, I am showing that manufacturing, distribution, patients, health provider, research and development, customer service. Like that, I segregated several sectors. Of course, it is having some more or multiple sub-modules. Okay, I think I completed more than an hour, the second poll of the day. Just for relaxation, the first computer virus is. Please click the link which is shared on your chat box and do your polling, or go to menti.com by using 6504828. Give your poll. In the past poll, the first poll, almost 20 plus participants polled, even though there is 100 plus participants. No, 40 participants polled. Among the 40, 23 belongs to computer science, 2 belongs to information technology, 3 belongs to MCA, and remaining 12 belongs to other category. Which means this is a technology which can be implemented irrespective of branch, so that people are attracted towards this particular technology. So the competition is really high for the participants, which means we are supposed to make the things in a quicker way. Otherwise, it is difficult to survive in this competitive world. Let me see the second poll results. I will give another 20 seconds. Please make it fast. Till we started the session 15 minutes late. Okay. So far, 5 participants made poll. The first computer virus is I love you, Buster, Sasser, Creeper, and so far 5 people polled. Among these 5, 4 people chosen the last option, and one person chosen the first and second option, Blaster. Okay, as I said earlier, I can keep open this poll also till end of the day. You can continue and complete as and when you get free. So we are talking about this IoT in medical management. In this particular sector, from the particular screen, I taken these things: research and development, manufacturing, distribution, healthcare provider, customer service as a broad categories. From the broad categories, again we can go for segregating into various subcategories. Then you may ask, sir, what is the scope? If I am choosing this, right? What is the scope for me? Is that beneficial? See, the global IoT healthcare market size is projected to reach almost 500 plus billion by 2025. Again, these are all predictions. So far, the predictions worked out well, right? So far. I hope definitely it will go higher only. Second, these are all real-time monitoring, right? These are all helping the people, specifically the disabled persons. So, still the market growth is increasing also. Second, you may ask, sir, which are all the companies in this particular sector? Maybe the company names are all new to you and unaware about this. This Biotronic, Boston Scientific are the two for Indians, right? So, as a computer technologist, market segmentation, we are having n number of things. This I already told many occasions, this wearable external devices. Similarly, the implanted medical devices, of course, this stationary medical devices. So I am these devices. Is there any other sector available for me? In that sense, if you are specifically there, you can go for choosing kind of remote management, data analytics, network security, network management, application security, like that, you can go for choosing. Services, system integration services, consulting, training, education, maintenance. No, sir, I am not interested in these also, right? Is there anything else? Yes. In the connectivity, I want to work in the Wi-Fi connectivity research. Either improvement or a new invention or a modification. Bluetooth low energy, ZigBee, near field communications, cellular, satellite. So in medical management itself, it is classified almost 50 plus way. What I told at the beginning, we are having a vast area to explore this particular IoT research. If you are choosing the healthcare itself having multiple numbers. Otherwise, in case of end user, clinical research organizations, hospitals, clinics, research, if you are interested in application, telemedicine, medication management, clinical operations, inpatient monitoring, connected imaging. Why it is required? Why healthcare IoT is required for us? Being able to monitor and support a person free from physical constraints will change the way doctors deal with patients. Right? Earlier days, we used to do like this. After getting some problem, we will go for diagnosis. That time, doctor will say that this is in the top level, peak level, difficult to treat. If you are going to IoT, as soon as we get the symptoms, alert will come. Right? This is a simplified way of living our life in a bigger happiness index. If you are really interested, then some more areas give us a tips. The hospital healthcare cloud can be with these modules, so that everything will become as a IPD, pharmacy, smart diagnostics, ambulance, bank workers, etc. things. It's taken from a reference, but still it will work out. We can go for various apps because nowadays it is available. And the suggested apps are displayed on your screen. If you are finding more than this, you please share with friends in the later days to update ourselves. Making collaborative. As I said earlier, the major modules can be split up into sub-modules, and for just a reference, these few modules we are having the digital stethoscope. I am sure machine, all our institutional gates are equipped with thermometer. Just we are measuring. Are we keeping some kind of data to the persons? You just imagine like this. The campuses are having the staff attendance by using thumb impression or eye, right? Along with that, is it possible for us to implement this thermometer too? Just to think. And so some possible IoT devices in healthcare industry. As on it is not available. It is available in the form of digital, but it is not storing in any database. The electronic medical record or health records be made simpler, easier. For your information, Kerala made such a way that all the government hospitals are connected through. The patients, those who are intended to go to government hospitals, are not needed to carry their past history records, provided they taken medication from government hospitals earlier. All the patient history is stored in the cloud, and all the government hospitals are connected with wire. So when we talk about IoT in healthcare, it is not possible for us to leave artificial intelligence, big data analytics, data security, and machine learning, deep learning, etc. things. So I feel that this particular healthcare industry is having a lot of advantages. Of course, Indian health industry is having a strong demand. It is expected to reach 370 plus billion US dollar by next year. That is the projection. 370 billion US dollar in India alone. When you say opportunities, several mergers, acquisition happening in healthcare industry, that to India, it reaches 1.09 billion US dollar in the last year. Third one, rising manpower. The number of doctors increased more than lakhs in the past year. Policy and support is also in a positive. If you are looking in that, the market size is increased for the past few years continuously, and the projection also in a positive. The two multiple way. The second, number of medical colleges, medical seats is showing. The premium collection for the insurance for the past several years witnessed the possibility for us to do projects in this area. Overall, number of devices connected, I told 50 billion. Among that, third is connected with healthcare industry, which is again more than 2.5 trillion US dollar. This is one major reason that our country is the place for other country people to take medical. Maybe because of that, the hospitals or health centers are increasing day by day. So if you are jumping into this particular industry as a research, it will definitely make us more revenue. Of course, the government initiative looking positive for the past 4-5 years. So Indian industry, the challenges again we can say security and privacy, because the technology adoption and the healthcare reform and mandates are in a poor manner. When we say poor manner, it is the opportunity for us. So I feel for us to make some products, research projects in this particular area. For example, I given some devices. Before, I have no doubt that in reality, the future will be vastly more surprising than anything I can imagine. Mentioned by the Holland, a British geneticist and evolutionary biologist. Of course, we are having a lot of threats. We will see in the afternoon session. Similarly, the acts also we will discuss in the afternoon session. Some IoT devices. This is not the finalized one. This is not the topmost one. Still, we may go for improving these things in the best possible. So before ending that, I can go for showing a video which is live simplified with connected devices. Maybe we can see in afternoon session, otherwise. Give me a moment. Thank you, Balaji Subramani, for your comment. So these are the few references which I referred for the morning session. We will meet in the afternoon session for discussing something, how to make our life in a simplified manner as well as easiest way with ethical and environmental conscious. That too with the implementation of Internet of Things day-to-day life. These are all few references giving some good thoughts whenever we go for reading those things. Whenever you get free time, you can go through it. If you are having any doubts, I am happy to clear, or otherwise we will discuss the second session and the last session of the day at 2 p.m. Thank you all for the patient listening. Over to the coordinator.
Thank you, sir. Participants will be having the same speaker for the next session. Kindly assemble at 2 p.m. You can leave the session after filling the attendance link. Thank you.
Professor, are you there?
Yeah, yes, sir. Sir? Sir, am I audible, sir?
Thank you, one person. Professor Balaji, I will share the PPT to the coordinator. Coordinator will share with you. In addition to that, the recorded session.
Thank you, sir. Thank you, sir.
Okay, thank you. If there is no question, we can wind up.
So actually, sir, participants want this PPT they have mentioned in the chat box. After that, we don't have any question.
Sir, audio is not.
I think, sir, so for participants, just that they want the PPT for this session.
Yes. Now it is audible.
Yeah. So we'll send to them, sir. Apart from that, they don't have any questions.
Excuse me, sir.
Okay, sir. Shall we continue that?
Thank you, Govindraj.
Participants, if you have any queries, you can ask now, or else we'll continue in the next session about the stress management. I think it's that clear, everyone. If no questions, we'll wind up the session, or else we'll carry out with your questions. Kindly mention in the chat box.
Sir, good afternoon, sir. Sir, it is audible, sir?
Somebody is asking questions. Muruganantham, sir, is that audible for you? Somebody is asking questions.
Meenakshi Patel, the coordinator, will share the PPT.
Yeah. So participants, you can mute your mic and you can speak. Unmute your mic and you can speak.
Ma'am, I have one query.
Yeah, yes, sir. Please do. Tell me your question. I can convey to you.
Ma'am, shall we continue with the afternoon session or else can I ask now?
Actually, sir, afternoon session is there, sir, about the stress management. You can ask now. And also, you can attend the afternoon session. It is the 12th session.
Okay, ma'am.
Okay, sir. So, speaker is with us in this meeting. You can ask your query. He will answer you. We'll discuss about that now.
Sir, can you hear me, sir? Muruganantham, sir?
Muruganantham, sir. Sir.
Yes, madam. Tell me, madam.
Sir, good
Yes,
afternoon, sir.
So we have
Sir,
a
can you
question from the participants, sir.
Yeah, yeah.
Sir,
Tell me.
am I audible? Yeah.
Yes, you are audible. Tell me.
Yeah. Yes, sir.
Good
Please
afternoon,
kindly
sir.
share it.
Sir, good afternoon.
Sir, just convey your question, sir. To the answer.
Yes, yes.
Okay, okay. Sir, my query is about what is the accuracy in the healthcare field of IoT, sir?
Healthcare field of.
About accuracy, sir. I'm asking doubt about the accuracy.
If you are asking about telemedicine, I will tell you.
Yeah, in the field of healthcare, sir.
Okay.
Is it possible to give 100% accuracy in IoT in the field of healthcare, sir?
It is possible. It is possible, right? It is possible. Only with the condition that we have to create such kind of machine learning algorithm. When you have two cases in this sector. When you say telemedicine, we people are always having the doubt that without seeing the patient, without touching physically to the patient, how the doctor will diagnose, right? That will
Yeah,
be the basic question.
yeah,
Every doctor is reacting based on the symptoms revealed by the patient. Only the temperature is taken by the doctor, right? Or the nurse who is standing outside the doctor's room. The blood test or any other test are all taken by the laboratory people. By looking the various results, the doctor is predicting or deciding that the particular patient is having so and so disease. This is what the things are happening. Of course, if a person is meeting in an accident, then definitely it is required a physical inspection by the doctor. There we cannot go for doing the telemedicine. Telemedicine says a person who become a patient particular category is diagnosed by the doctor and it is required to observe the patient for a period. In that scenario, telemedicine is the best one. No need of going back again and again. For example, a sugar patient, right? The sugar patient can test him by himself by using a equipment nowadays. So he can consult the doctor through telemedicine. Based on the records stored about the patient's sugar level for the past several years, the doctor will give suggestions or alternative medicines through telemedicine. Right?
yeah, sir. Thank you, sir.
So definitely IoT will play a major role in healthcare industry. It is already started in abroad and the grown countries. We are supposed to deploy so that we may also make our life in a positive. Thank you.
Thank you, sir. Thanks a lot.
Thank you, sir. Thank you, participants, for your patient listening. We shall continue this program by this next session on 2 p.m. Thank you, everyone. You can.
Okay, thank you all. Bye.
Thank you, sir.